when we were doing healthcare reform, my main complaint was, hey, listen, we didn't change the system, right? Now, how many times do you guys hear me say that, right? Only 1.5 million. And I said, look, my main problem isn't any particular thing, oh, public option or this or that. It's just the heart of the system is exactly as it was before, with private insurance companies still left in charge, right? So, and then, of course, I was dismissed by the Obama lovers and Obama himself and Robert Gibbs and said, oh, they'll never be satisfied with anything. Oh, please. Historic healthcare reform. Historic. Mission accomplished. What are you talking about, right? So, one of the things that was historic about it, apparently, was that starting immediately, that you will not be able to discriminate against children with pre-existing conditions anymore, which is fantastic. And look, I said there was always sorts of good things in the bill, right? And starting in 2014, you're not going to be able to discriminate against anybody with a pre-existing condition. But immediately, we were going to start with no discrimination against children with pre-existing condition. Now, but I said, wait a minute now. Look, as long as you leave the private insurance companies in charge, they will find a way to manipulate these rules. So guess what's happened immediately? They have found a way to manipulate the rules. So what are they doing? Well, WellPoint and Coventry One, two of the largest healthcare companies in the country, are saying, hey, you know what? Well, then we're not going to cover any children. How do you like us now? Look, I'm going to do my what did I tell you? Second, go ahead, you tell me what I told you of this story, okay? I said, look, they're going to get rid of a whole bunch of people. They don't care. They just want to cover the richest people, right? Because they make a better profit margin off of them. They want to cover the healthiest people, the youngest people, etc. But whatever they might not make a good margin on, they're not the government. They don't give a damn about the general welfare. And they don't really particularly give a damn about their clients' welfare. Their job is to make as much money as possible. So if they say, oh, we're not making that much money off of kids, well, there goes the kids. Oh, they don't have health care anymore? Who cares? They're not my kids. I got no issues with that. So they've dumped all the kids from their programs. And who are they blaming? They're blaming healthcare reform. They're blaming the Democrats. They're blaming Obama. Just like we told you they would. Why? Because we didn't get change. They're still in charge. They're going to keep raising our premiums and keep denying us health care. And they're going to find every other way to do it. Because there's no alternative. There's no public choice where we're going, hey, you know what? If they deny my kids, I'm going to go and have, like, for example, a public option where I can go and get health insurance from the government and they won't let my kids get sick or die, okay? Or my grandmother or anyone else. But we don't have that, except we have a president who put up a mission accomplished banner. By the way, as far as the industry is concerned, their top lobbyist was a woman named Karen Ignani, and she was the president and chief executive officer of America's health insurance plans. That's all the health insurance companies put together, and she was their top lobbyist. And at the time, she was bragging. She said, health plans recognize the significant hardship that a family faces when they are unable to attain coverage for a child with a pre-existing condition. It's like, oh, I know. My heart goes out to those kids with pre-existing conditions. The healthcare industry wants to help them. We want to help them. She goes on to say, that is why health plans in 2008 proposed reforms to make pre-existing conditions exclusions a thing of the past. So she's saying, we get about the kids. We're going to make it a thing of the past. We're volunteering to do that. She said, with respect to the provisions related to coverage for children, we await and will fully comply with the regulation described in your letter. We'll fully comply. And then it passes. They're like, fuck up. We're going to fully comply. Bunch of idiots. Okay, we're not going to comply with dick. Okay, your kid's gone. Okay, not covering them anymore. They get sick. That's your problem, not my problem. I'm not making enough of a buck off your kid's health. Okay, so sad day for you. You know what we might have needed? A second option where we know we'd be covered. But I'm the unreasonable lib. I'm the professional left. What would I know? I don't have the genius of Rahm Emanuel. I don't have the genius of all these guys in the administration. I don't know how to play political chess. No, Obama, you nailed it, man. You nailed it. That's why I hear everybody across the country saying, oh, I'm going to vote for Democrats in 2010. You know why? My health care is so much better today than it was before. Yeah, oh yeah, my premium's going way down. Yeah, no question. Oh, well, I'm covered, and I'm positive that if I get sick, my healthcare company will cover it. Today and in 2012 and in 2014. That's why I'm voting for Democrats. Have you heard a single person in the country saying that? A single one? No. I know I'm unfair. Most of it gets implemented in 2014. Yeah, good luck with that. Now, you know what? I'm going to rub it in. Because I was right, and they were all wrong, okay? Every time they fail, okay, every time something like this comes in, I'm going to come in and I'm going to rub it in and rub it in and rub it in. Not because I don't want to succeed, because the exact opposite. There is a way to succeed. You're just not doing it, okay? And then you tell me I'm unreasonable. You know what's unreasonable? Not doing a goddamn thing and then pretending you did reform. Oh, we covered 32 million new people. You'll see, wait till 2014. They'll be totally covered. I could be wrong. I could be wrong.